Hello, thank you for watching my presentation. My presentation will be over Taxol, and my name is Amy Lamb. So, an introduction on Taxol. It is also called paclitaxel or Taxol. It's a plant-derived drug, and over here I have posted the chemical formula of Taxol. And it is isolated from a bark from the Western yew tree in the 1960s by researchers. This type of drug is used in chemotherapeutic um, treatment for cancer patients. Sorry. So this drug Taxol, it is a microtubule disrupting drug, and by those means, it means that it disrupts the microtubules from the mitotic spindle. So the mechanism of action, let me move this out of the way. So the mechanism of action for Taxol, so it has the ability to stabilize and prevent the microtubules to undergo depolymerization. And I have posted an image with the credit underneath right here of what happens where you add paclitaxel, sorry, or Taxol when it's administered. Um, so when Taxol is administered to a patient with cancer, it can lead to the cell arrest or cell cycle arrest at the G2 or M phase of the cell cycle, also known as the prophase and the anaphase. And basically, that will cause cell death. And that's the mechanism of action that it will go through. It can also modulate the cell survival rate through the apoptotic proteins and the signal pathways during its administration. And it can basically activate or inhibit, sorry for the typo, but activate or inhibits the pro or anti apoptotic proteins that cause cancer cell death. And it can also affect the calcium that's stored in the endoplasmic reticulum, and it will be attacked. Basically, the calcium will be attacked and it will become released to disrupt the calcium homeostasis that affects the cell survival. So this is an example figure that I got from a case study article that I took off of PubMed. And in this research study, um, what they did was they were trying to find, I guess they were trying to use the exosomes as a drug delivery vehicle by transporting the Taxol into the body and without it being affected to where it can be more effective to treating cancer. So what they did was that they used Taxol to treat multi-drug resistant cancer, the MDR. And in here, they used 6 different mice. They were murine model mice that had Lewis lung carcinoma in them. And with this figure that I have picked from that article, this is where they were testing the tumor progression in this figure. These are the different mice. And in this method, so basically what they did was they had the 6 mice, they were injected with M27 cells, the cancer cells. And so for 7 days that they were injected, um, on the seventh day, they injected them with the different experiments that they had, which were the saline, which is a control, the exosomes that didn't have any Taxol in it, which is also another control, and then Taxol and exo-PTX, which is the exosomes that already were harboring the Taxol inside of them. And so they continue to inject them with these controls in the experiments to the mice to test for the pulmonary metastasis. And on the 21st day is when they stopped injecting them. And by the 22nd day is whenever they basically, they say sacrifice, but they killed the mice. And then that's when they did the studying on the histology and doing the x-rays on the mice to see. And so in here, they use saline. Like I said earlier, they use saline and exosomes as a control. The XOPTX was the Taxol, the new formulation of the Taxol that was loaded with it, or the exosome that was loaded with Taxol. And the researchers' study was to see if the Taxol loaded exosomes can be used as a chemotherapeutic drug in MDR cancer. So when you look at these different slides right here, you can see in the controls that those red marks are the M27 cells, and you can see that there's a lot of them in there, and that shows that those controls they didn't have any type of therapeutic drug in there. It didn't do anything to help reduce the cancer cell growth or anything like that. The Taxol, even though it was administered and it is used as it's supposed to be used as a cancer treatment, you can still see some red, although it's not the same as both of these, but it's just a little red. So it shows that it is effective, but it's not very effective. And you can see it reflects from the infrared graphs that they took of the mice of the tumors that were inside of them. And then for their experiment that they used their new formulation of the exosome loaded with the PTX or the Taxol, you can see that there's, in my opinion, there's really honestly no red. And in the article, it said that there was very, very little to no cancer cells still left in there. With the figure B, I mean, in this figure, you can see on B that it's showing, that it's the least, it shows the least amount of the cancer cells in there, which you can also see in the infrared imaging that compared to all the other ones, you don't see much of the tumor mass inside of the mice. And then for cancer disparities, so there were a few disparities that I saw, and so I picked the mortality disparities based off of your race and the socioeconomic factors from one of the articles that I found. And this is the graph that I'm showing for the different types of cancers throughout the years of different races. And you can see throughout the graphs for male and female, you see that the highest numbers or the highest rates throughout the years were between African Americans and white uh, African American males and females, and also white males and females. They were pretty similar, even though the males rating was a lot higher. So I did a ethical research paper over why this type of disparity normally forms. And there's a lot of possible relation that goes back to the medical ethics issues between African Americans and medical professionals because of the Tuskegee experiment. If you're not familiar with that experiment, that was back in 1932 to 1972, where they basically used African American male subjects to test for the cure for syphilis. And they had judged it as medically unethical because even after they found a treatment with penicillin for syphilis, they were still using those subjects and just basically treating them badly and letting them suffer and have consequences of being treated with the syphilis afterwards. And so in my paper, in the other article that I used for that paper that I wrote, it was stating something that how basically like till this day, like there are some African Americans who choose not to go get medical help when they're sick based off of that Tuskegee experiment. um, Another factor that I picked was the socioeconomic status. So the mortality rate is a lot higher in poorer countries in comparison to other countries that are not as poor. And that could be because of a lot of different factors like, not having the ability to get medical attention or medical help, not having the financial abilities to go. So there was a lot of different factors that tied into that. And I think what the US could do to basically try to help and fix these type of disparities, I think maybe they could offer a better type of medical help for everybody, like not only just for rich people or middle class or the poor, but especially for the poor people. I feel like they make it very hard for people who are not as rich in the economic status to get medical attention. And I think that's why people who are from poorer countries, or even people who are in a lower class in America, they have a higher mortality rate or new cases developing from, the poor status, because of the inability to go and get that type of medical help whenever um, they need to be treated, or if they have complications with their health and things like that. And this is my reference page of all the references that I used to help me construct my presentation. Thank you so much for watching. And if you have any questions, please leave me any comments and I would be happy to answer them. Thank you.